How does the Medicare Part D drug benefit work? Well, start off with the easy part, the part that everybody understands. That's your monthly premium, what you pay every month. Every plan's going to be different, and you'll be shocked that some plans might have zero monthly cost, which is kind of misleading because there's cost there somewhere, but you might not have to pay a monthly cost. And you'd say, why? How could that be? That is because they have a whole bunch of backdoor rebates. Don't say kickbacks because that's illegal. Stuff going on behind the scenes so that the insurance company gets money. So some plans don't really need to charge you a premium. So there are plans in about 40 states that might have a premium under $10 a month. Now, other plans might have a premium that are $150 a month. So the monthly premium, the average annual cost, how much you will pay for Part D, is going to be based on the drugs you take and the state that you live in. Medicare Part D drug plans are based on your zip code. And then it doesn't matter your gender or your age or your actual health, it'll come down to your prescriptions. So when you go to Medicare.gov and look for drug plans, if you have a Medicare supplement plan, you will do this every year to check on your drug plans. You will type in your exact drugs. So it'll say, you type in metformin. They want to know exactly what type of metformin, your exact dosage. Then you put atorvastatin. Again, go to the next one, lisinopril. Some people are taking these three drugs. There's some common drugs that everybody takes. And a lot of these drugs are cheap. They're generics. So you might put in all your drugs and then you hit, boom, give me my annual cost for Medicare Part D. And it might say a cheap plan is your cheapest plan. It might have no monthly premium. And then it might say, if you're lucky, it might say you don't have any cost for these drugs because you're taking very, very cheap generic drugs. That's happening less and less so. But typically it will say, this is the cheapest plan for next year. Your monthly premium is X. It'll give you the lowest one. And then it'll tell you your annual drug cost expected for the year. That's based on you taking these drugs at these dosages for the full year. And every drug is based on its price. Its price is based on its category. So as you can expect, the cheap drugs have a cheap category, tier 1 or tier 2. And the expensive drugs are going to be tier 3 or tier 4. The most expensive drugs are going to be tier 5. So ideally, you don't have anything above tier 2. Those drugs will be expensive no matter what drug company you go with, and they go up every year. Now, we talked about premium. That's what you pay monthly. Then we talk about the tiers, 4 different tiers of your drugs. You will have a copay for each tier drug. And like I said, some of the generic drugs, the tier 1 drugs, the copay might be $0, or it might be $5, or it might be very low. Every drug company sets their own prices. So you can get lisinopril from all these different companies. It might be $3, $8, $10. Another company might be $12. So they can decide what they want to charge for it. When you put your drugs in at Medicare.gov, it will tell you which plan has the cheapest drug plan for all of your drugs for the following year. So you're like, great, I'm going to choose this plan. Well, the little secret is the drug plans can change how they categorize your drugs, and they can change the prices, and they can change their mind about covering your drug completely. So you type in your drugs at Medicare.gov. It says this plan is the cheapest. You hit enroll. 4 months later, you get a letter from your drug company. It says, Dear Sylvia, we are no longer covering your expensive drug. Thank you. What? They are allowed to do that. When you enroll in a Medicare Part D drug plan, you are locked in for a calendar year. So if you buy a 2026 plan, you are in that plan. You can't get out of that plan unless you move to another state. There's some exceptions, but in general, you can't change. If your insurance company sends you that letter and says, Sylvia, we're not covering your expensive drug, that is not a reason you could change. We hope that doesn't happen. It happens more than what you would think. So let's say worst case scenario, you do eventually get a letter saying the drug that we thought was $5 is now $15, or the drug that was $10 is now $50. So you don't like that, or we're not covering your drugs. You know now that you can't change drug plans What you could do is you could appeal to your drug company. You can beg them for an exception. Say, please, please rethink this. I really need this drug. And sometimes they do. I've seen people be very successful getting exceptions for MS drugs in particular. And I don't know the game, why the drug companies would not cover it, but then make an exception. I don't know, but that is part of the game with Medicare Part D. You have to understand that the parts are changing, but you are locked in to a calendar year for all intents and purposes. So I don't want to scare you, but I do want you to have realistic expectations, because sometimes people call the Medicare Family and they are piping mad. They are screaming about these changes that we don't know will happen. It's not public. Insurance professionals don't have any idea this will happen. We don't find out until you find out. So I agree, you should be mad. I don't like the way the system's built, but don't be mad at us. We are the messenger. Do not kill the messenger. The messenger here is just trying to educate you about what to expect when you get on Medicare Part D, when you get a drug plan. And I'd like to remind people that before 2005, for 40 years of Medicare, there was no drug benefit. So as much as it's not perfect, I still remember the days where there was none, and this is a lot better than nothing. So it's not perfect. So we said you have a monthly premium, which you may or may not have based on what plan you choose. Then you will pay copays for your drugs. Then you have a deductible. The maximum deductible for 2026 is set by the government. That is $615. Now, that's the maximum deductible. Your company, most companies, can charge lower than that. So you might not have to pay the full $615 up front before you get to the copays on your drugs. Especially if you're just taking cheap generics. Most companies, but not all, if you're taking a cheap generic, they waive the deductible. The deductible is out there for the expensive drugs. So the deductible plus your copays, not your premium, the deductible plus all the copays out of your pocket that you pay throughout the year for your medications. That together comprises your out-of-pocket maximum. And for the first time ever, in 50, almost 60 years of Medicare, there is a maximum you can pay out of pocket on Part D. That was brand new in 2025, and that was $2,000 in 2025. It's going up every year with inflation. It'll be $2,100 for 2026. So that means if I'm taking, let's say Mounjaro, and it costs $1,000 a month, that I'm not going to pay $12,000 for Mounjaro. As soon as I get to the $2,100 mark, I don't pay any more for my drugs for the rest of the calendar year. So the out-of-pocket maximum is protection for you. Now the insurance companies are tricky. So they are covering fewer and fewer drugs because of this new burden imposed upon them by the government, which is the out-of-pocket maximum. Now the out-of-pocket maximum, $2,100, does not include your monthly premium, okay? It includes your copays and your deductible. And some of the premiums are quite high for 2026. The government allowed the insurance companies to raise their 2026 prices $50 a month over their 2025 prices. So it's a $600 increase. Historical, very high. And I will tell you that the insurance companies were mad that it was limited. The government said you can't go above $50 a month. The government's never stepped in and done this before. The reason they did is because the drug companies wanted to go way higher than that. And there's a whole backstory of what's going on, but this was all caused by the Inflation Reduction Act, which gave us the limit, the out-of-pocket maximum on your drugs. This out-of-pocket maximum, the $2,100, this benefits about 3% of people on Medicare, not very many. But for those people that were taking a large amount of drugs, they're saving on average $6,000 per year because of this new cap on drugs. Now, they're saving money, and the rest of you all have to pay more money to cover those people. That's how insurance works. Somebody's got to pay. The money's coming from somewhere. So if they're saving money, everybody else is paying more money. So in general, due to the Inflation Reduction Act, due to the $2,100 cap on drugs, you will see the copays have gone up. You will see many plans have the maximum premium, which is a $50 increase for 2026 over 2025. You will see that again for 2027. That's not going away. So the good news is if you do take a lot of very expensive drugs, you are capped off once you hit $2,100. The bad news is the majority of people aren't going to hit that amount. You'll just pay more in general. One of the things the drug companies are doing to prop up their profits is not covering more drugs. So you might find that your drug's not covered by any insurance company. Now you have to go into the creative zone to try to figure out if you can get assistance with that drug. First place you will go is to the drug manufacturer, AbbVie, Eli Lilly, Novo Nordisk, the drug companies, Roche, and go and look for their patient assistance program on their website. Some of them automatically deny you if you're on Medicare. Some of them, like the Eliquis drug plan, they are still available to you, even though you have Medicare Part D, as long as you meet their income and their asset tests. So your first place is to go there. Your second place is to start getting creative. Mark Cuban's low-cost pharmacy, Amazon, Canadian Drug Mart, getting drugs through the mail from Canada, generic discount cards, brand name discount cards. Most people are familiar with GoodRx, but they've never heard of Clever Care, BlinkRx, Single Care. There's lots of different drug discount cards. So if you have several drugs that you need help with, you might be using different sources to get your different drugs. I had one lady send me her spreadsheet. It was a lot of work for her to put together, but she was really savvy because she figured out how to get each drug at the cheapest place. And I'm going to throw a wrench in there for you. Just because you have Part D, just because your plan covers all of your drugs, does not mean you want to use your insurance to get those drugs. Let that sink in. That doesn't make any sense. You're paying for insurance and then you're deciding not to use the insurance. Why would you do that? Because if you're clever, you might go up to the pharmacist and say, what's the cash price for this drug? And she might say, this is $3. And you'll say, here's my insurance card. What's my insurance copay? And she might say, $8, $15, $12. What? It can be cheaper with cash? It can. And you won't know that unless you're savvy and you're asking. So on your cheap generics, even if you have a relatively low copay on your drug insurance, you ask that pharmacist what the cash pay price is. Now, pharmacists are not required to bring this to your attention. They are not required to tell you, hey, GoodRx or Single Care or BlinkRx are way cheaper. Look at these discount cards. A lot of times the pharmacists are really helpful and they will bring this to your attention. And other times of the year, especially during the fall when everybody's changing their plans, they're swamped. They're busy, tempers are high, and they're just like, next, next, next. They don't have time to kind of help you navigate this and find the cheapest way to get your drugs. So I want you to be a savvy consumer because your drug prices are going to be one of the biggest costs in retirement. I want you to familiar yourself with the drug discount cards. Not just GoodRx, who has the best marketing. It's not necessarily the best price, but the best marketing. Single Care, CleverRx, BlinkRx. There's a lot of them. And like I said, you might use one discount card for this drug and a different discount card for this drug. And then they change that every month. So don't think, oh, I figured this all out. Now I got the year ahead of me. No, they change their prices. They also might change the locations. You might have to go to a different pharmacy to get the best price. You might just throw your hands up and say, this is too much. It is too much. It is too much for most people. That's why help your parents, help your friends that are incapacitated, because this is really a lot of work on Medicare Part D. Now, let's go back all the way, rewind to the people that don't take any drugs. A lot of people that don't take any drugs say, well, I don't want to buy a drug plan. I don't use it. Insurance is for the unknown. So I want you to get a drug plan. I hope you don't use it. That's the best case scenario. Are you sad when your house doesn't burn down? You paid your house insurance premiums every month. Are you sad you didn't use it? No, you're happy that your house didn't burn down. I want you to feel that way about your drug plan. You need a drug plan, and I hope you don't use it. But buy one anyway, even though you're not taking medications or you're taking very cheap generics. Because right around the corner could be a very severe illness. Nobody plans for these things. Nobody expects to get these rare diseases. And those things come with very expensive drugs. You might be one of the people that benefits tremendously from having the $2,100 cap on your drugs. A lot of people are going to say, I don't need a drug plan. So let's talk about the late penalty. Let's say, for example, you're turning 65. You know you want a Medicare supplement because that's the best comprehensive type of insurance, but you don't really want a drug plan. You don't take any drugs, so you don't buy a drug plan. And then you wait 3 or 4 or 5 years and maybe something happens down the road. So now you want a drug plan. You can always get one. You can get back in the system in the fall, October 15th through December 7th. But the government is going to hit you with the late enrollment penalty since you didn't enroll when you were first eligible. Now that penalty is only 1% of the average national price. So for 2026, that's $38 and I think 99 cents, something around there. They will hit you with a 1% penalty for every month you're late. So 1%, how many months times that national? So let's say you're 1 year late coming into Medicare in 2026. That means you'll pay a penalty just right around $5 a month. And you're like, $5 a month, that's nothing. It's not bad. But you'll pay $5 extra every month for the rest of your life. And the penalty goes up every year. So the penalty for 2026 is based off of this average national price, $38.99. But next year it'll be higher. And then in a couple of years it'll be $45 and it'll be $50. Your penalty is still tagged to the average national price. So your penalty is growing. And the example I gave you being $5 a month extra, that was for being 1 year late for Medicare Part D. So let's say you're 5 years late. You can see how this penalty can be quite financially devastating. So that's not even the real threat, the penalty. The threat is that you declined Medicare Part D because you're healthy. And then 3 months from now, that's when you get something bad and you found out you need a Stelara injection and it costs $10,000. So then you're calling the Medicare Family right away. Can you help me get a drug plan? We can't just put you in at any time of the year. You have a federal right to get back in, but you're going to have to wait till next fall between October 15th and December 7th, and your plan will start next January. So you could go a whole year without any help on Medicare Part D because you were gambling that you were going to stay healthy and you lost that gamble. So I recommend everybody get a drug plan, get the cheapest plan available in your state, and hope you don't use it. But make sure that you're covered so you have it if you need it. The drug companies are not required to cover every drug. And there's like 4 categories of drugs. They have to cover all those drugs. But they don't have to cover all the drugs. There's thousands of drugs. The list of drugs that each drug company covers is called a formulary. It's like a recipe. And a lot of them cover the same drugs, but you might find only one covers this drug. So you want to look at that formulary. If you have a drug plan right now from last year, they could have changed the list. A lot of people don't do anything. If you don't do anything, if you don't check, then that drug plan will roll over into the plan for the following year. And then you're locked in for the following year. But that's when you find out, ooh, they don't cover your drug anymore. So if you have a standalone Medicare Part D drug plan, you need to go to Medicare.gov every year, type in your drugs every year, and see what will be the cheapest plan for next year. Too many people don't do that. They assume it's going to be about the same. And they find out in January or February that it's not the same. The price went up and they're not covering some of your critical drugs. So formularies are important and formularies change. They're never locked in. Some people don't need a Medicare Part D drug plan because they get their care through the VA. The VA, TRICARE for Life, they volume buy Medicare drugs, so they have the lowest price in the nation. And then some people get their drug benefits through their federal employee retiree benefits. But most people are going to buy their own drug plan. Now, I've been talking about a scenario where you have a Medicare supplement plan and a separate drug plan. About half of all people are going with private Medicare, which is a Medicare Advantage plan. Most, but not all, Medicare Advantage plans have the drug benefit built in with the health benefit. So everything I've talked about when I've talked about Medicare Part D, premium, deductible, maximum out-of-pocket, formulary, copays, that same system functions inside the Medicare Advantage plan. So you're getting your drugs through your Medicare Advantage plan, but the government still sets those same rules. Your plan will decide the premium, the copays, the deductible, just like your plan would if you had a standalone drug plan. So a big one that confuses people is if they want to get their drugs through the VA or TRICARE, but they want to get a Medicare Advantage plan, Which drug plan? They want the drug benefits through the military. They're better. You would buy a Medicare Advantage plan without drug coverage. That's called a Medicare Advantage only plan. And some of those people make a mistake every year because they have a Medicare Advantage only plan and they think, you know what, I think I will go to Medicare.gov and see if I can get a better drug plan. And they find something and they enroll in it, and that terminates their Medicare Advantage plan. So make sure you know what you're doing. If you have questions, email our client care team. Our email is hello@the Medicare Family. We can answer questions, help guide you with your Medicare drug needs, with all your Medicare needs. If you're getting ready to go on Medicare, we help people in all 50 states. Our help is free because we're paid as independent contractors by dozens and dozens and dozens of insurance companies. So wherever you are, we can help you. You can book a free appointment on our website, themedicarefamily.com. Now, if you only need help with a standalone drug plan, we cannot help you with that. Those drug companies stopped working with agents. So you will have to go to Medicare.gov to get your own standalone drug plan. We can help you with Medicare supplements or with Medicare Advantage, dental, vision, hearing, cancer, many, many other types of plans, but they're no longer working with agents for the drug plans. I hope this video was helpful. If you learned something, please give me a follow, like, share it with your friends that are your similar age. Thanks.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.